Welcome back. February is National Children's Dental Health Month, but children's dental health isn't just for young kids. Teenagers have dental needs as well, and Dr. Brian Dunlap of Dunlap Dental is here with pointers on keeping your teenagers' smile healthy throughout the year. Thanks for joining us, Dr. Dunlap.
I appreciate you guys having me once again.
It's great to have you. This is a time when teenagers are getting a lot of work on their teeth, braces, retainers, mouth guards. And sealants is really what we're talking about today.
Well, I think that's the most important thing that we're going to talk about today is sealants, because I think it's one of the most important things that we do as dentists. And I think it's a very simple procedure. It doesn't require any numbing or anything. And what it is your kids are going to get a set of 4 molars when they're 6 years old, and another set of 4 molars when they're 12 years old. And these teeth have a lot of grooves in them, and they're very deep into probably the teeth that people get the most cavities in. So when you get them right when they're 6 years old or right when they're 12 years old and these teeth have just erupted, if you can just flow a simple sealant in the grooves and seal them up, doesn't take any time, and again, it's painless and no numbing. It's amazing how much less decay that you will have over the years for these kids. And so it saves the kids from having discomfort and from cavities and having to get worked on. It also saves the parents money from having to get fillings or even worse, crowns done later on these poor kids. So I think overall it's easily one of the most important things we do.
Something very important to talk to your dentist about. Okay, mouth guards, the next thing we want to talk about today.
Yeah, obviously most kids are doing some sort of athletics. And I think, all of us, know the old school football mouthpiece, but it's really important. I think basketball, soccer, lacrosse, there's a lot of sports that are popping up that there's contact, and obviously there's some risk for some shots to the teeth. So it's really important to get some mouth guards. A lot of times dentists can make a custom mouth guard that's going to be a lot more protective than the ones that you're going to go buy at Walmart, although those are or Target wearables. Those are good too, to go get the old boil and bite, the old rubber ones. But, your dentist can provide one that's got even more protection. And again, keep from getting your front teeth knocked out. That would save you a lot of time and anguish and money for the parents too. Okay,
braces, finally, a very important topic to talk about. Ages 4, 8, and 14, that's a normal age that these teenagers and kids are getting braces.
Well, it's a little bit different than when I was a kid. When I was a kid, they usually didn't start braces till later, and I think I had braces until I was about a sophomore in high school. That's unusual now. They're usually getting them done a lot earlier. We're able to, with the technology we have, we spot things a little bit earlier these days, I think, and a lot of times orthodontists will get things started a little bit earlier, and what happens is you can do the younger the kids are, you can move teeth a little bit easier and quicker, and then you have less work to do maybe when they are up in their middle teen years. And you can set things up, and a lot of times people think about braces, oh, I'm just trying to have a pretty smile. There's a lot of times where you're also trying to correct some bite problems that can really affect you on down the line. I have some adult patients that have some really bad bites and end up having some health problems because of that, and it would have been really helpful if they had gotten braces as a kid. So there's more than just a couple of reasons why you might need braces than just having a pretty smile, which is also nice also.
Oh, well, and as you said, braces have come a long way. What are your thoughts on the Invisalign and the invisible types of braces?
I think the Invisalign is fantastic. We do a lot of Invisalign in our office. Now, I pretty much stick to adults on the Invisalign because it requires a ton of compliance.
Okay.
And we all know how that can be with a teenager or with kids.
Exactly.
And my adult patients love the Invisalign. It's fantastic because you basically can straighten teeth without having braces, and people don't even know really you're doing it. And it's not uncomfortable. It's real simple. Most of the cases are less than a year, and they go real quickly. So I've had a lot of adults that have really enjoyed the Invisalign, and they do have Invisalign Teen.
Okay.
I haven't used it yet. Usually I think that with the teenagers, you're probably better off with the braces because requiring, maybe a 12-year-old to remember to wear those all day long every day. I'm not so sure
Go
how
ahead
well
and get the permanent ones. Yes, exactly.
No.
So you don't have to negotiate with them to get that on.
Yeah,
great advice. Thank you so much. Tell us where you're located.
We're on Aldersgate Road, which is right off of Canis behind Baptist.
Dr. Dunlap, thank you so much.